So the next question is, what are the kind of main contributors, I guess, to fatigue in training? Because like fatigue management is kind of one of those things where it's kind of a commonly used phrase, but what do we actually mean? So when we talk about fatigue and we talk about the contributors to that, we can break it down into our basic training principles. So the first thing that we might look at would be the amount of training volume that you're doing. Now we can just think of this, let's say if we focus on a single body part and we focus on the number of sets that you're doing for that body part. So for example, let's talk about the pecs or the chest muscles. Okay. So this obviously involves joints as well because muscles cross joints. So we're kind of focused on the shoulder and the elbow joint as the joints of interest when talking about chest training. So we're kind of focusing on our pushing movements. You got your chest, you got your shoulder joint, and then you've got your elbow joint. You've obviously got triceps, delts, etc. as well involved. Now, if we start training and we're doing 5 sets per week and everything's going smoothly and we continue to increase that, there's going to come a point at which maybe your elbow starts to hurt or your shoulder starts to hurt or your chest just isn't recovering anymore. It's constantly tight, really sore for days. And that's that point at which you begin to cross that threshold. So for most people, somewhere between 10 to 20 sets per week per muscle group is going to be a tolerable range, and it's going to be a range that's going to lead to kind of fairly robust outcomes in muscle building. Okay, now obviously the less well trained you are, the lower it's going to be. The more well trained you are, the higher it's going to be. Okay, so volume is something that can be very easily well, I wouldn't say easily. I was going to say it's very easily overdone, but I think the reality is that people very often will do 30 sets per week, but they're actually only doing 15 sets of high quality, kind of like you said previously, Patty. And the remainder is kind of junk volume, like they're not really pushing themselves anymore, or maybe they can't push themselves anymore because their shoulder's starting to niggle or something along those lines. But all that extra training is contributing to additional fatigue, even if it's not of high quality to lead to additional adaptations. So you need to find that point yourself at which you feel like you're tired, your muscles have been working, maybe you're sore for a day, 2 days or so, but you're not sore consistently throughout the week and you're not experiencing significant joint pain. So I would start, if I had no idea how to set up my program, what I would do is I'd start at around that 10 set mark. I'd set out a 6-week period, and over that 6-week period, or 4 to 8 weeks, let's say, I'd build up to somewhere between 13 to 15 sets for that muscle group of interest. And then I'd see, how did I recover at 13 to 15 sets? Was I starting to get quite sore? Was I starting to lose quality of the reps? Or, was everything just perfectly fine? And there's a point there as well where if you're feeling super fresh after those 13 to 15 sets and you barely feel like you've trained, you barely got a pump, I'd be inclined to continue pushing that volume up. Now, that also assumes that everything else has been done well. So your rep execution is good, you're choosing appropriate exercises for that muscle, you're pushing close enough to failure, etc. So that's the first thing, is volume overall.
Just on that as well, we have to take into account that fatigue accumulates, right? So when you're trying to push up that volume across, the weeks, 4 to 8 weeks, whatever it is, you have to pay attention to not only the workout itself, but how you feel going into that workout. Like you might be like, okay, I'm going to bump up to 15 sets per week. I think I'm ready for it, right? Like you have to pay attention to, what did I feel like going into that session? What do I feel like going into that week? Where are my muscles still fatigued from the last training sessions? How is the training I've done affecting the training I want to do? Because all of that helps you, make better decisions in terms of like, oh, am I actually recovering? Because what often happens, and this is especially true of the people who, propagate the idea of increasing sets across a training block, that's their mode of progression. Like, even if you didn't increase the sets, like you still have more fatigue going into week 3, week 4, week 5, week 6, can't even speak, week 6, because of the training you've previously done. Right. And they always say, fatigue masks fitness. So you're not going to be able to express your best fitness or your best results, if you will, in the gym, because you are accumulating more fatigue. And that might be what you want. for sure, right? That might be the progression method you're using. However, when we're at this point and we're trying to dial in a specific amount of volume that allows us to manage fatigue, we really have to pay attention to, like, how did my last training session affect this current training session that I am doing or want to do? Like, was I going into the session feeling like, oh, like I'm still a bit fatigued from that last session. I still feel a bit sore. I still feel like my shoulder was still a little bit at me. Like, that's all information that we can use to better dial in the, actual training, I'll say load, and by that I mean intensities and volume, so we have to pay attention to the subjective as well as the objective here.
You certainly do. And when you kind of transitioning a little bit, but when we talk about training volume, then we have to also ask ourselves about not just like the per muscle group volume, but what does the overall training week look like? Because this is something that you'll often see where people will say, right, you said do 10 to 20 sets. So I do 20 sets for every muscle. And then you look at their program and they've got like 20 sets for chest. And then the day after they're doing 20 sets for shoulders, like loads of pressing again. And there's huge crossover there in terms of, firstly, obviously the joints that are moving and all of the intrinsic muscles at those joints. And even like the anterior delts being worked on chest day and shoulder day. And then you look at their program again and they've got an arms day where they're doing loads of dips, and they're doing loads of skull crushers. And again, you've got this crossover in the fatigue from each session.
Yeah, the classic example of this, and anyone who's really tried to push the envelope with like training volume and training overall will have seen some sort of 6-day training program, a legs push pull split, or I should say push pull leg split. That's generally the way it's framed, because obviously you have to train chest on Monday, so it's push session first. But just think about the crossover fatigue, because again, like Gary said earlier on, we're not just talking about muscles, we're also talking about joint structures overall. So think about this: if you did a push session on your first day, right? Even if you're looking at the overall training volume in that session, you're going, okay, I'm going to keep this relatively in a good place. I'm only going to do whatever 8 sets for this muscle group. You're paying attention to it, right? And you're like, I'm going to repeat this next. I'm going to do a Monday chest and shoulders and tricep session, and I'm also going to do something similar on the Thursday, right? So you're like, there's 2 sessions there. You could look at that and go, oh, it's just those 2 sessions, the crossover between those 2 sessions that I have to be aware of. And that's just not the case. There's far more crossover, because think about this, right? First of all, you're using your shoulders when you're doing any chest exercise, so there's some crossover there. But okay, let's say you account for that. You're doing maybe less anterior delt work, and all your direct delt work is all like, we'll say middle delt work or rear delt work. So you're like, okay, I'm paying attention to that. I'm still managing fatigue. But when we go into the next training session, which is supposed to be a back training session, like, we've already taxed the shoulder girdle the day before, right? So your shoulders, the musculature around there, the tendons, ligaments, etc., have all been used. And while you're thinking of it purely in terms of a context of, oh, I'm just pressing on day 1, so when I'm pulling on day 2, who cares? But your joint structures, they fucking care, because they've already been put into a somewhat fatigued state, right? But okay, maybe you manage that well, and you're like, okay, that's grand. I'm going to choose different exercises that target different things. But now you've trained back, right? And then you're supposed to be training legs the next day, and all of a sudden you're like, oh well, when I was training back, I was doing some like bent over rows, and I was fatiguing, my rhomboids, I was fatiguing my spinal erectors, I was training the overall back. And now you're going into a leg day and you're trying to do a set of squats, which puts a lot of pressure, or we'll say, forces through the shoulders, which have been fatigued for the last 2 days. You have to hold the bar there, right? You're in this externally rotated position with your hands, everything, but you have to hold the bar there. And then also your entire back musculature is fatigued. So, stabilizing the bar is quite tough. And then you actually go to do the squat and you're like, oh, well, actually my low back, my spinal erectors were challenged the day before as well. So we're in a terrible recovery position from all of those different muscle groups because of the training sessions you've done previous to that. And then you go, all right, you know what? Thursday, we're back again. We're into chest, shoulders, triceps. And it's like, okay, well, when are you actually giving these different joint structures some time to actually recover, some time to actually, effectively manage this fatigue load over the overall week. And this is generally why with a lot of my clients, I do try to focus on, the minimizing the crossover effect, but also having some sort of rest period in the midweek period, and not just having like 3, 4, 5 days that run straight into each other, because that generally means that you're going to have a lot or a significant amount of crossover in general.
Yeah, and that's huge, and especially I think for like the lower back ends up being a limiting factor for many lifters, because even if you just look at that like legs push pull setup, what people will often do is they'll have like a deadlift variation and some rows and stuff on their pull day, then they'll have their squats etc. on their leg day, and then their push day, it's like, okay, that doesn't seem like it's intense on the back, right? But on that push day, even little things like arching loads for all your sets of bench press and your overhead presses and everything, and then you wake up the next day and it's like, oh, lower back's just a little bit stiff, just 10%, it's not much at all. But you then enter that leg session and you're going close to failure on your squats, and you're doing some glute ham or RDL or something along those lines, and again the back is like, maybe it's like 30% fatigued now, it's not too sore, but yeah, you're starting to feel it a little bit. And then you go into your pull day and you've got your deadlifts, you've got your bent over rows. And what you find is the deadlifts went fine, back became a bit of a limiting factor towards the end. But when it came to the bent over rows, like your lower back was now the limiting factor, and you weren't actually able to train your lats or your upper back muscles well. And that's the kind of classic example. I always have that report from people who, especially who run those kind of 6-day programs, where they're just not able to do certain exercises for their back because their lower back ends up being the limiting factor. So you have to consider the overall training week. And that's obviously really important as well for people who are doing some form of concurrent training. The classic example is a field sports athlete, GA athletes, they train Tuesday, Thursday, and then game on Saturday or Sunday, let's say, something along those lines. And they want to train their legs twice per week as well. And if you're, setting up that training week, you have to ask yourself, okay, when do I want my legs to be freshest? Okay. Is GA my priority? Yes, it is. I want to be able to perform well. Then you don't want your hardest leg day to be on Friday before the game on Saturday. Clearly that's silly. Okay. So what you might do is have a hard leg day on Monday. You might go into Tuesday's training session feeling, a bit sore in the legs, but generally Tuesday might be the easier training session of the week before the game, let's say, something along those lines, or you don't push yourself as hard. And then you do your lighter leg day on either the Wednesday or the Sunday after the game, or whatever way you end up setting it up. The general point being, or the general gist being, that you need to ask yourself, how's the fatigue from this training session going to affect performance at the time that I want to be able to perform my best? So that might actually change for you if you have a game that week or you don't have a game that week. If you're just training, you might be able to push the envelope a bit more. And then when you have that that game week, you might actually pull back a couple of sets, particularly for those muscle groups that you feel might be a bit restrictive for performance. So one of the things that I would do fairly frequently would be, if I have a person who's training their legs hard, they want to get stronger legs, bigger legs, but they also want to be able to perform on the pitch, then what I might do is, on those weeks where they have a match at the weekend, is I might pull out a set from each of their hamstring exercises and tell them to leave an extra rep in the tank. It's a fairly subtle change, but it means that they're probably going to go into the game then, feeling like the hamstrings are actually fresh and that they're not already fatigued. Because especially, it's a sport by sport basis, but you want to ask yourself, what muscles are actually at risk of injury here as well? So not just performance, but also risk of injury. For example, hamstring strains, super frequent or super common in field sports. So I don't want that risk to be elevated because of training that we're doing on the side, because we want our training that we're doing on the side to be serving the purpose of injury risk reduction. So we could go over countless examples there, but the overall point is that you need to look at the overall training week first and foremost, and then you need to look at the different activities that you're doing within that week and what your priority actually is. And this all goes back to the start of the training series, where you need to do a needs analysis. You need to know exactly what you're aiming at. Is leg day your priority, or is hurling training your priority, or soccer training or rugby training? You need to figure that out for yourself. Okay. Now, The other subdomains of the training principles that might be important here would be things like intensity. So, for example, firstly, intensity in the way I guess that people kind of use it every day. How close are you pushing yourself to failure? How hard are you training? Okay, you can do a lot more sets, 5 reps from failure, than you can if you're taking every set to failure. So that's pretty simple, pretty self-explanatory. If you're going closer to failure, you're not going to be able to handle as much overall volume. So those two training principles interact all the time. The other component of that, and that's maybe a little bit more complicated, is absolute intensity. So the percentage of your 1 rep max, or how much overall weight you're lifting, and most importantly, what that is relative to your max. Okay. So if you're going in lifting 90 to 95% of your 1 rep max and you're doing that every day, that's going to be tough work. Even if you're only doing a couple of sets or 1 set, that's going to be tough work, because the overall stress on the body is very, very high as you get closer to a 1 rep max. And obviously, if you're also pushing that really close to failure, that's going to be even more challenging again. So that's something that's really important, because sometimes people will transition into a strength training phase. Let's say they normally do 8 to 12 reps, and now they're going to do loads of singles or loads of triples or loads of sets of 5. And they might, do a similar structure to what a powerlifter might do, but they haven't actually got the same capacity for handling that level of volume in that intensity range. So there's some specificity there as well, where like saying that you're going to do 5 sets of squats when you previously did 5 sets of 10 to 12, and now you're going to do 5 sets of 3, they're totally different stimuli. And you may find that that's actually far more fatiguing for you. Whereas the powerlifter, if they were to do 5 sets of 12, any powerlifter will tell you that would be hell for them. Okay. That'd be really, really difficult. And that kind of goes back to, what are your own strengths and weaknesses? What are you used to? Obviously, there's individual factors like muscle fiber type and all that sort of thing. But the most important thing, I think, really, if you've been training for a while, is how different is what you're about to do from what you normally do. And if you were going to do, sets of 20 on squats and you've only ever done sets of 3, like that's just going to leave you so fatigued and so sore. And the other thing there as well is that there's somewhat qualitative differences in the type of fatigue that you're going to get from those different activities as well. So if you do, sets of 20, you're going to be super sore from a muscular perspective within and after the session. Whereas if you do sets of like 1 to 3, you don't get that same level of muscle soreness, but you get this feeling of just like dread and overall systemic fatigue. Okay. So you're going to feel really zapped. You're going to feel like, that gave you the same amount of fatigue that you would from 3 normal sets, and your head's kind of hurting because you push fully to failure. And anyone who pushed themselves to a true 1 rep max will know exactly what I'm talking about there. And there's also the additional thing there where when you work with heavier weights closer to your 1 rep max, any deviation from your normal technique is going to have a potentially bigger impact. So for example, if you're at 100% of your 1 rep max and you shift your hips slightly to the left, and now you're mainly on your left leg, you were already at 100%. So you don't actually have much more to give from that left leg. So there's a higher risk of potential catastrophic injury. Now, it's not very common at all, but if you were to do 100% of your 1 rep max every single session, then those small risks would certainly add up over time. So that's another thing that has to be considered in the discussion of fatigue. Do you have anything to add there? We'll continue.
Oh, basically, you just need to manage your training load, intensity, and volume. Like we've talked about these principles before, and if you've understood the rest of the training series, the programming series, if you will, like you start thinking about these things, and then you start layering on the fatigue management stuff, and you go, okay, this makes a lot of fucking sense. This is probably why all these different programs that you see, propagated online or whatever, this is why these ones are more successful than these ones. Oh, this is why these certain populations struggle with these things. And then it starts all to kind of click a little bit more.